Hello and welcome. This webinar focused on the effects of water quality and climate on public health is part of a fall series of online education produced by the Daugherty Water for Food Global Institute at the University of Nebraska. And we do this in partnership with our valued colleagues in Nebraska, across the US, and around the world. I'm Molly Nance, Communications Director for the Institute and your moderator for today's event. As we all know, water is a vital resource for our world. We use it for our personal daily needs, for outdoor recreation, to grow our food, run our businesses, and support our natural environment. There are many factors that can impact water quality that in turn can impact human health. Our expert speakers today will discuss these challenges and ways in which we can prevent and mitigate water contamination. It is my pleasure to introduce our webinar speakers today. Dr. Ann Hubbard is a medical doctor and professor emeritus of radiology for the University of Nebraska Medical Center, as well as president of the Claire M. Hubbard Foundation. Dr. Jessie Bell is the newly appointed director of the Water, Climate, and Health Program at the University of Nebraska and the Claire M. Hubbard Professor of Health and Environment at the University of Nebraska Medical Center. Dr. Shannon Bartelt Hunt is the chair of the Department of Civil and Environmental Engineering at the University of Nebraska-Lincoln. Mike Sousek is the general manager of the Lower Elkhorn Natural Resources District in Norfolk, Nebraska. And Dr. Alan Kolok is professor and director of the Idaho Water Resources Research Center at the University of Idaho. First, we'll hear from Ann. Welcome, Ann.
Thank you. Yes, I'm Ann Hubbard, and I am the president of the Claire M. Hubbard Foundation. It's a small family foundation that focuses on the environment, science, education, research, and issues within Indigenous communities. I just want people to know, too, that less than 4% of philanthropic dollars goes to environmental issues. I was asked to tell how I came to fund this new Center for Water, Climate, and Health. And that is really putting together a lifetime of experiences. I am a physician, a retired pediatric radiologist. Most of my career was at the Children's Hospital of Philadelphia. My clinical load and also my research work mostly centered around prenatal imaging of fetal anomalies and then imaging of babies once they were born with defects. A baby born with a defect may face a lifetime of medical needs, and it can be a full-time job for any family who has a child with developmental anomalies, particularly here in the United States, where we don't guarantee health care for everybody. And particularly if you look at diseases like spinal cord defects, that is one of the most financially catastrophic diseases a child and a family can encounter. Living in Philadelphia, it became obvious to me too how much the environment that children grew up in affected their health and their development. You know, we had an aging infrastructure, particularly in the neighborhoods surrounding the hospital, with lots of issues related to dust, molds, lead in paint, and then water contaminants that were in a 200-plus-year-old water system. In my personal life, I found nature in my mid-20s, and it was so important for me to be outside in nature for both my physical and my mental health. Much of that time was spent doing water sports like kayaking and rowing. And so I was able to see gross contaminants in the water, such as plastics and styrofoam. I also, because of living in Philadelphia, knew that the river that I rode on had, again, over 200 years of industrial contaminants in it. So the times that I fell in that water, I made sure to get out of there really fast and get to a shower. In a new chapter, I moved back to Nebraska, where I'd grown up about 15 years ago. I continued to practice pediatric radiology at the Children's Hospital here and at UNMC, and began to learn more about diseases that have increased incidences in Nebraska, such as pediatric cancers, and particularly among them, pediatric brain tumors, non-Hodgkin's lymphoma, pediatric leukemias, and also that there's an increased incidence of birth defects, and particularly spinal cord defects and cardiac anomalies. There's also increased incidence of adult diseases such as cancer and Parkinson's disease. So I really wanted to dig down into more of what were the causes of this. And I know I'd met researchers and clinicians that were already doing research on this and seeing that there were particular pockets where these diseases occurred. Also, as I came back here, I became more involved with a variety of environmental organizations. And I think because of the uniqueness of Nebraska lying on the Ogallala Aquifer, the issues of water really come up frequently. And so I learned a lot about the issues of ground versus surface water. And I was amazed, perhaps shocked, to learn how many things were in our water that I'd never really encountered before. Not just industrial waste, but also agricultural contaminants, naturally occurring elements such as uranium and others. And then medicines, so antibiotics that might be related to human health or animals, and also things like hormones, antidepressants and opioids, all of which can then get recircled in our water systems. I've also had young friends that live in areas of the state where their wells are contaminated, and they didn't trust the water treatment systems that they had in their homes. So they proceeded to buy bottled water for several years during both pregnancy and while their children were young. So not only do we have issues with contaminated water, then you're adding more contaminants with all the plastic bottles that are produced. Also, this is a little aside, but I know that there are minimal acceptable levels for contaminants in waters, but those are all really based on diseases in adults. So what is the minimal acceptable standard of a contaminant when you're talking about the developing fetus or young child where cells are growing continuously? With all of this, I also have had the opportunity to meet any number of scientists working at the University of Nebraska on issues related to water quantity and also water quality. So anyway, that gets us back to the foundation. So with that, we really have a desire and, more importantly, are responsible to do the greatest good that we think we can with the money with which we were blessed. And what better thing could we do as a small organization than try to improve the connection between human and environmental health by funding this new center? We know that everything is life, everything is connected. And as my Native American friends will tell us, and remember, it's not nature and us, that we are nature. So everything that's out there becomes a part of us. And remembering too that water is life, how important it is for all life. So my big goals with this project are, one, to promote the importance of the work of public health, both in terms of research and practitioners. We've, again, I think I mentioned before, kind of forgotten how important it is to try and prevent diseases as opposed to treating them. We want to give a financial boost to research that's already being done throughout the University of Nebraska system, but we also want to build on excitement for new research and new collaborations within the University of Nebraska system, but also beyond, both nationally and internationally. Our goals too are that everybody should have safe, clean drinking water available. People deserve to know if their water is safe, and have easy ways of testing that they can afford to test. If water is contaminated, we need to be working on changes in both industrial and agricultural practices and personal practices. And that can be done through both education and research. We need to look at new, novel engineering ways, solutions to remove contaminants from the water that are affordable for both cities and individuals. And we need to very much continue to work on policy, both nationally and locally, that promote clean, healthy water and clean environments. So it is really exciting for me to see this project come together. It's been really wonderful to see people across the University of Nebraska system come together in relationships that haven't been there before. And these will be new ways of working on challenges of water issues related to human health and all health. And I hope that you will work on it quickly. Thank you.
Thank you, Anne. I so admire the work that you're doing, and especially your passion for public health and the environment. And thank you especially for founding this important new program. It'll be exciting to see the research focusing on solutions to this global challenge that we have for improving water quality and health. Next, please welcome Jesse.
Well, just to start off with, I want to say that I really appreciate Dr. Hubbard's generous support of this program. Because of her support, we'll be able to address and work on some of the major water quality and quantity issues that we're facing here in Nebraska. And like as Molly already said, I'm the new director of Water, Climate, and Health at UNMC and DWFI. And so, next slide, please. And so with the new Water, Climate, and Health program, we're going to be tackling water quality issues. And we know that here in Nebraska, we definitely have a number of water quality issues that we already face. As Ann highlighted, and as others are going to talk about today, we see high nitrate concentrations in groundwater across the state. And here are two news reports from the Omaha World Herald and NPR talking about the costs that that's having on rural communities. Next slide, please. And then also the water quantity issues. And this is where that climate piece really comes in. And that's both flooding and drought, which here in Nebraska especially, we're very familiar with. Where last year we saw significant flooding across the state. And then this year we saw a pretty impactful drought as well. Next slide, please. And so our mission at Water and Climate and Health is to create interdisciplinary collaborations across the University of Nebraska system to address Nebraska's public health challenges related to water and climate. That's our first focus. And we're going to do that through research, education, policy development, and training. Next slide, please. And we have a number of public health challenges that we have to face here in Nebraska around water and climate. Next slide. Before I talk about some of those challenges, I just want to talk a little bit about Nebraska itself. 20% of Nebraskans get their water from domestic private wells. 80% get their water from community public water systems. Agriculture accounts for about 92% of Nebraska's land use, and 1 in 4 jobs in Nebraska is related back to agriculture in some way, with there being about a little over 77,000 producers here in the state. In 2019, it was estimated that about a little over 660,000 people that live in Nebraska, of the 2 million people, roughly 2 million people live in Nebraska, those 660,000 live in rural areas. And we also know that we have 4 state and federally recognized tribes with headquarters in Nebraska: the Omaha, Santee Sioux, Ponca, and Winnebago. And we also have other tribes that have representation here in the state as well, with the Iowa, Sac and Fox, Pawnee, and Ogallala Sioux. Next slide, please. And so going back to it, like I said, one of the things we're really interested in is preventing disease. And that's what we're hoping to tackle with the new Water, Climate, and Health program. And we know that we have water quality issues, as I've already mentioned, across the state. This map up in the left side of the screen is median nitrate concentration in groundwater from 1980s to 2018. And you'll see that, so what we have here is any county that has orange or red is indicating a county that exceeds 10 micrograms per liter during that time period, median time period, or median concentration during that time period. 10 micrograms per liter is what the EPA standard is for water quality. So anything that exceeds that exceeds the EPA standard. And as you can see, we have a number of counties that exceed that standard. We also have a number of counties that are pretty close to that standard as well. And then over on the right side of the screen, we have the median atrazine concentration in surface water across the state. And as you can see, over that exact same time period, as you can see in the eastern part of the state, we see higher concentrations of atrazine in surface water. Next slide, please. And why do I bring that up? And as Ann mentioned, we already know that nitrates and atrazine have connections to human health. And there's been studies here in Nebraska and studies nationally as well that have shown that nitrates and atrazine can actually be linked back to cancer and pediatric cancer. And we know that Nebraska has one of the highest pediatric cancer incidence rates in the United States. And this is based off of the CDC report that came out a few years ago. Next slide, please. And we know that those pediatric cancers aren't evenly distributed across the state. There are certain places where we see higher rates of pediatric cancer than others. And so at the top, we have all pediatric cancer. And as you can see, there are certain counties, the orange and the red are ones that indicate where those counties exceed our statewide incidence rate. And then at the bottom, we have pediatric brain tumors. And as you can see, we have more population or more people, higher incidence rates of pediatric brain tumors in the eastern part of the state. And again, the orange and red indicate those that exceed the statewide incidence. Next slide, please. So we have a lot of work to do on preparing our communities for some of these problems, some of these environmental challenges that we face, both today and in the future. And those are public health, and that's through public health preparedness, emergency preparedness, and healthcare preparedness as well. Next slide, please. Because we know some of our challenges, especially our challenges around climate, are going to continue to evolve in the future. Over the last 50 to 100 years, we know that Nebraska's temperature has increased as it has across much of the United States as well. And we know that over that 50 to 100 year time span that Nebraska has also seen an increase in precipitation. Next slide, please. And we expect that our climate will continue to change. We expect that as our temperatures continue to rise in the future, that our winters will get wetter and our summers will get drier. Next slide, please. And we understand what it means here in Nebraska, what a wetter winter could potentially lead to. Last year, in March of 2019, we saw significant flooding that hit throughout this region, not just Nebraska, but throughout this central part of the United States. That flooding cost the United States at least $10.8 billion of economic loss. There were at least 3 people that died due to that flooding, and hundreds of people were displaced. And it ended up being the costliest inland flooding event in US history. Next slide, please. And so with that, we want to try to make sure that we have a safer and healthier Nebraska today and moving forward. And we're going to do that through identifying multidisciplinary solutions to Nebraska's water and health issues, by building collaborations with leaders that are already tackling some of these water and health issues across the state, educating and informing Nebraskans about these environmental issues, providing mentorship and support to the next generation of problem solvers, and recruiting experts, both within the state, across the country, and internationally as well, that can help address these issues. So we can learn how to solve them here and take that information to help solve problems elsewhere as well. Next slide, please. And so with that, I just want to thank my team, Megan Langle, who's a new program director for Water, Climate, and Health, Siddhi Mundi, who is a research data analyst that's working with us, Connor O'Neill, who's a graduate student here in COPH, College of Public Health. I also want to thank again Dr. Hubbard for her support, Dr. Kahn, Mike Boehm, Peter McCormick, Ellie Rogan for helping build this and make this come to fruition. And then Molly for putting on this webinar and some of her support through all this as well. It's greatly appreciated. And then UNMC, UNL, DWFI, and the Nebraska Foundation. And I also want to thank our panelists today. We're going to hear a lot about some of the issues that we're facing here in the state and try to figure out what are our next steps for trying to address some of these issues and how water, climate, and health can fit in. And so with that, I just want to say thank you very much, and I greatly appreciate your time.
Thank you, Jesse. It will be so exciting to see how the Water, Climate, and Health Research Program grows and develops. I have no doubt that you and your team will come up with some pretty exciting, innovative solutions. Next up, we will be hearing from Shannon.
Great. So just again, to quickly introduce myself, my name is Shannon Bartelt Hunt. I'm chair of the Department of Civil and Environmental Engineering at the University of Nebraska-Lincoln. And I've worked for a number of years in the area of water quality, specifically in agroecosystems, looking at the intersection of contaminant occurrence and transport and adverse health outcomes and biological endpoints of those contaminants. So Just to kind of reiterate on some of what Jesse presented, we're focused on the intersection of water quality and health. A lot of the health data that Jesse presented in the prior set of slides was represented at a county level. And so one of the tacks our team has taken, which includes both Jesse and Alan Kolok, one of the later presenters, is to also think about how we can represent health data on a watershed basis and then link that to the contaminant transport processes that occur within that watershed. So first, just to provide a little bit of background information, what is a watershed? A watershed is just a geographic area, land and subsurface, where all of the water is draining essentially to a point, a river, a stream, or a lake. And so what we're interested in is obviously within that watershed, contaminants are also going to flow to those same water sources. And then we have populations living within these watersheds. And so we're very interested in how we can look at the intersection of water quality and health across a watershed scale. Next slide. So again, my focus is primarily on water quality. So just also want to point out that there are a number of different sources of contaminants into watersheds. These can include point sources, such as industrial discharges or water treatment, wastewater treatment plant effluents, but we also have a number of diffuse non-point discharges, surface runoff from agricultural lands or urban areas. And when those contaminants enter water, they can then distribute to a number of different places. They can infiltrate down into our groundwater. They can be carried by surface runoff into surface water. And again, in our work, we're interested in measuring the levels of different contaminants in all of these different compartments. Next slide. So as Jesse mentioned, we're interested in water quality, specifically in Nebraska. Nebraska is a very agricultural state. The maps on the left, the top map is a map of the nitrate flux across the United States, and Nebraska is really kind of centered in that dark brown area in the center of the country. Similarly, with respect to atrazine, we apply a lot of atrazine to primarily for corn in the state of Nebraska. And again, you cannot see the state outline because we're in kind of this darkest area for atrazine application in the country. And as Jesse mentioned, we find these contaminants routinely in Nebraska, and we're concerned about it because of their potential link to human health. Next slide. Also want to point out that there are other types of contaminants that we're very focused on here with respect to water quality. One example being antibiotics. So just showing one slide of data from a study that we conducted in the Shell Creek watershed, which is located in the central part of Nebraska. This is a watershed that contains about 1,000 people, but it contains tens of thousands of animals, primarily cattle and swine. And so we did a monitoring study where we looked at different points along Shell Creek throughout this watershed, where we detected the presence of mixtures of different antibiotics, and then correspondingly detected resistant strains of bacteria that are involved with human infections. And so just pointing out that this suite of contaminants that we're interested in spans from more conventional contaminants such as nitrate and atrazine to more emerging contaminants such as antibiotics. Next slide. I think a really important part of this center and the goals of this center is highlighted by this slide, which is a commentary from the Lancet Planetary Health, explicitly calling out the lack of studies that connect watershed science and public health. So I think this is a real need globally. When we think about watershed science or water quality, we're not fully connecting that to human health endpoints. And then in the public health realm, when we're conducting studies of of public health, we're not going back and linking that to how we manage our water within watersheds. And so I think the work of this center is really going to help to fill that really important gap. Next slide. So again, just to reiterate, what are some of these connections between water quality and health that we're specifically focused on in Nebraska? The first, as Jesse mentioned, is looking at the connection between cancer, specifically pediatric cancer, and exposure to agricultural contaminants or environmental contaminants. In Nebraska, we do have elevated incidence of certain types of pediatric cancers. And we're finding that those areas of elevated incidence correspond or correlate with areas where we have higher concentrations of nitrate and atrazine within the watershed. Also, with respect to antibiotics, there's a very important public health connection to the development of environmental antibiotic resistance. We have limited numbers of antibiotics available to us. There's more and more evidence being developed that the environment can be a reservoir of antibiotic resistant genes and also antibiotic resistant pathogens. And so we want to look at how those environmental exposures can lead to the development of antibiotic resistance, which can then reduce the effectiveness of our available antibiotics. And then finally, this bottom slide just showing that there are already correlations that have been determined between agrochemical concentrations and adverse health outcomes. So this figure from a paper from a number of years ago shows a correlation between the number of birth defects, which is represented by this dotted line, plotted by the last menstrual period of the mother, versus atrazine concentrations in surface water collected from across the United States, which are represented here. And you see at these peak atrazine concentrations in May and June, you see the corresponding peak in birth defects from children that were likely conceived during that period. And so it just, again, highlights the importance of connecting these two types of data. Next slide. So in order to make these connections between water quality and public health and human health, we need to have a lot of water quality information. I think in Nebraska, we do a great job of measuring water quality. That's done by the state. It's done by NRDs and other agencies. However, we still have gaps in our data. This map on the left was a map developed by the Nebraska Department of Energy and Environment, showing the mean nitrate concentration by township. And so each one of these, what looks like a square pixel, is a township, but you can see the gray townships across the state have no water quality information for nitrate. And so we still have huge spatial gaps where we don't have good information. Also, if you look on the right, this is an atrazine record over a number of years for a particular watershed in Nebraska. And because we're routinely collecting this water quality information in response to regulatory needs and actions, we have gaps in these data sets because it'll be monitored for a period of time, and then that monitoring will shift to another part of the state, then may come back and monitor. But what that results in is kind of this uneven record. And so when we're looking at health outcomes like pediatric cancer, where you can have a latent period of tens of years, you need to have these long records of water quality so that you can make correlations. Next slide. And so what we're interested in, and what my group in collaboration with others have been working on, is how do we fill in these gaps of water quality data? One way that we are proposing to do that is with the use of citizen science. Citizen science, which can also be called crowdsourced data collection, is a fantastic tool. We can both collect accurate water quality information by training volunteers to serve as citizen scientists across the state. There's an added benefit that then these individuals who participate in our programs gain a lot of knowledge about their local water quality in the area where they live. Next slide. So just to talk a little bit about one of the programs we have running in Nebraska, started in 2018 to recruit people to measure surface and groundwater quality. We're focusing currently on nitrate and phosphate and measuring those contaminants in water just using very simple colorimetric test strips. We provide training to everyone who participates in our program, either in-person training for groups, school groups, or community groups, or online training via some YouTube videos that we've developed. And the plot at the bottom just shows the growth of the program over time, just demonstrating that there's a real interest on the part of individuals to participate in collecting data about their environment where they live. And so it's been a very successful program. Just putting in a little plug, our registration website is here. We, of course, had a slight break in our program due to the pandemic, but we're back collecting water quality information this fall. And so if you are local, you can sign up to participate in our program. If you're not local, but would be interested in some of our resources and how we've set up the program, again, please reach out. I would be more than happy to share what we've learned about how you could set up a citizen science monitoring program in your own community. Next slide. So just showing very briefly one of the types of data that we can collect from citizen scientists. This is data just showing the concentration of nitrate measured in wells across 45 counties in Nebraska. We were able, over a 2-year period, to collect over 500 well quality observations. And as you can see, we find results that really are corroborated with other types of studies that we have nitrate in our groundwater. And so you can see here that if you just look at the total bar, for example, the number of samples that exceed 10 parts per million or 10 milligrams per liter, which is that water quality standard, about 20% of the wells fall into that category. But even more concerningly, there's some information that there can be some health consequences, especially for children, if you have nitrate above 2 parts per million. And so again, if you look at that lower value, which is below the current drinking water standard, but we have over half of the wells tested that have nitrate present at 2 parts per million or greater. This is a concern for us in Nebraska due to the health issues associated with nitrate. And so this is something we're going to continue to work on, how we can find solutions that benefit residents who are using these wells for drinking water. And I believe that's my last slide. I didn't add an acknowledgement slide, but at the very least, I'd like to acknowledge the funding for our citizen science program, which has primarily come through the Great Plains IDEA, a clinical and translational research center at UNMC.
Shannon, thank you so much for your insight. Very fascinating presentation. And I thought your citizen scientists were darling.
Yes, they were.
Next, we'll hear from Mike with the Lower Elkhorn Natural Resources District in Nebraska.
Thank you, Molly. I guess I'm going to build upon what Jesse and Shannon have already presented, but bring it down to a much more local level. So as Molly stated, my name is Mike Sousek. I'm the general manager of the Lower Elkhorn Natural Resource District. For the benefit of the audience today, I'm going to just describe a little bit of what a natural resource district is to give you a better idea of what my job entails. Next slide, please. There's 23 natural resource districts in the state. I'm just going to refer to them as NRDs from here on out. My district happens to cover most of Northeast Nebraska. We have all or parts of 15 counties. You can kind of see to the left there where we sit in relationship to the state. Next slide. We operate under an elected board. My district has 15 board members. Every 2 years, there's a 4-year term for the board member. Every 2 years, we replace or we have elections and the board changes all the time. We do have property tax authority up to 5.5 cents per $100 of valuation. So that is some of our operating budget, but we also are supported a lot by grants, different foundations, and depending on what work people want to do. And then we were developed to provide local solutions to local problems dealing with 12 statutory responsibilities. Next slide, please. Our responsibilities include groundwater for beneficial use, both quantity and quality. We do get into public water systems. We own and operate a few of those in my district. And then we also get into the management of the connection between groundwater and surface water. Do a lot of work with soil, erosion, conservation, do a lot of work with flood prevention, drought mitigation, recreation and parking facilities, which are usually tied to some of our flood control projects. And then we also do a lot of work with forestry and range management. Next slide, please. So we're going to start focusing on the water component of this presentation, and then I'll work my way into the health component. As I told you before, I'm going to really bring this down to a local level and highlight the issues that we are facing here in Northeast Nebraska. Next slide, please. Here's a map of Bazille groundwater management area. This is 21 townships. This kind of lays over 4 different NRD districts, but we have about 30% of this. To give you a little context of this, all this area is sandy soil, very coarse soil. Until the 1970s, with the introduction of center pivots and irrigation, this area was mainly native grasses, pasture, and some range grounds. So here's the nitrate problem back in the 80s. Irrigation just started in the mid 70s. And we started realizing that we were having nitrate problems showing up in the water. The yellow area is just below 10 parts per million, the maximum contaminant level that EPA has set, and then the orange level is over 10, orange and the reds. So here's a map of the 80s. You can see there's quite a few communities involved in this area. Next slide, please. Here's the same area through the decade of the 90s. As you can see, the heat map is growing, it's changing, but the problem is becoming worse. Next slide, please. Here are the 2000s. As you can see, we're not slowing down, we're not shrinking, but if anything, we're continuing to grow, and the problem is compiling on itself. Next slide. And here's the latest data, latest map I have is up till 2014. As you can see, there's a lot of the area is now red. We are testing irrigation wells primarily out in this area, and we're getting results anywhere from 50 to 70. I've seen results of 80 parts per million in irrigation wells. We have a serious problem here with the nitrates, and from what I can tell, we're needing a lot of help. Next slide, please. As that same area, you can see over the time there that the last data set we had, nearly 67% of the wells were over 10 parts per million, and almost 30% of the wells were over 20 parts per million. That's a lot of irrigation wells out there that are getting sampled, and the results are what they are. Next slide, please. This is Pierce County is just south of that area I was describing. Here's a 20-year trend line from 1997 to 2017. You can see even at 97, we were already over 10 parts per million, and we're creeping up to the 18, 19 parts per million now here in 2020. So the trend isn't slowing down. We're continually increasing, and in my lifetime, I hope to see this at least plateau, if not start to decrease. Next slide, please. The other thing we're concerned with, as been mentioned in the previous presentations, it's not only nitrates, but some of these agrochemicals that were showing up in the water. You can see the different types of wells that were tested, whether they were commercial, domestic, irrigation, livestock, and all of them have nitrates in them. Some of them are showing up with the atrazine, and then those wells, when they have both nitrogen and atrazine, are believed to start contributing to the health effects, which we will get into next. Next slide, please. So let's focus on the health. Next slide. Non-Hodgkin lymphoma is the 5th most common cancer in Nebraska. Your incidence is increased when you live by or near agricultural communities, and that risk is associated with the pesticide exposure and the exposure to nitrates in drinking water. So when you have both those in your water, your risk is much higher. For non-Hodgkin lymphoma, you're 2.5 times higher for getting that disease if you're exposed to nitrogen and atrazine. And for indolent B-cell lymphoma, you're 3.5 times. And it's believed by the study that was done by Martha Rhodes from UNL that the changes are happening in the fetus formation and causing mutations in the chromosomal levels. So if you want to read that study, I posted it here, and you can get into the weeds in more detail. Next slide, please. The other thing I wanted to address today was the birth defects, not only in Nebraska, but mainly in my district. You can see the national birth rate for birth defects is 3.3%. The Nebraska rate from 2005 to 2014 was 5.8%. There's somewhere between 600 to 1,200 reported birth defects, and they range from cardiovascular problems, nervous system problems, intestinal, skeletal, urinary. You can see the breakdown there. And in the latest numbers I've seen, the actual numbers probably maybe closer to 1,400 reported birth defects. Next slide. You can see on the map here, I have the district highlighted, outlined in a thick black line. The state average, as I said, was close to 6%. I'm experiencing things in my counties closer to the 9 to 12% are reaching these birth defects per 10,000 births. And if that number is closer to the 1,400, of course, we're looking at maybe a 14% incident rate. All this is being correlated back to the nitrogen in the water and the atrazine. Next slide, please. So I want to focus on the future, kind of talk about what we're doing, and then where I hope we can go. Next slide. So currently the NRDs have been given the authority. We developed a groundwater management plan, and that it's accompanied by rules and regulations. The NRD started 1972, so we've been at this for almost 50 years. A lot of our work has been done through education, voluntary programs, cost sharing, best management practices, trying to get people to voluntarily change some of their practices as it relates to nitrogen. The other thing we're doing is technology, always trying to get the best and latest out there, precision agriculture, precision irrigation, and doing what we can to limit the leaching of the nitrogen through the profile. We also work with demo sites, partnering with UNL. We have test plots out there currently, really trying to grow crops with the latest and greatest, and then share that information with the producers in the area, showing them what can be done and how it affects their bottom line. The other thing we're building upon a little bit more and more all the time is the citizen science. We do this in 2 ways. One, we have partnerships with the local high schools, working with the students to go out and test water, usually surface water. We work with UNL on Know Your Well program, and we have some groundwater education, groundwater festivals that we do for the children. The other programs for the adults, through our rules and regulations, we're kind of requiring soil samples, water samples, nitrogen reports, nutrient management plans. All these things have to be filled out yearly. And part of the education there is to show the producers what's out there, what doesn't need to be added to the system for the crop, and really trying to take advantage of the nitrogen credits out there to use some of this nitrogen rather than continually add it. Next slide, please. The future continued. I'm excited about this new program with the water, climate, and health. I really believe that more work needs to be done with the medical community in Nebraska to identify not only the diseases, but the areas in the state that are associated with nitrates and how that correlates with some of these problems that we're seeing. We're continuing to work with the University of Nebraska, not only to identify new science, but new technology, and bringing that information to the public sphere. Sometimes I feel like we get caught in our silos and we're doing a lot of great work, but we're not really getting it to the people that need it. And so I'm hoping some more work can be done there on educating the public on the problem. And then the last thing, of course, is working with the people that live here, the stakeholders, not only to recognize the problem, to identify it, define it, but then to bring some acceptable policy outcomes to address the problem. I look at this data, it's very alarming to me, but the problem doesn't really seem to resonate with the general public. For whatever reason, they're disconnected, and we need to find a way to make this relevant to everyday people, and hopefully that would help us address the problem. Next slide. That's all I have for today, so thank you for inviting me, and thank you for attending today.
Great presentation, Mike. It's important to see how water quality issues affect local communities and how organizations are working together to improve it. Like you, I sure hope we can get more public attention brought to the issue of water quality. Hopefully this webinar is one step in that direction. Next, I would like to welcome Alan.
Thanks, Molly. Before I begin my talk, I'd just like to thank Dr. Hubbard for her gracious gift that she's given both the Daugherty Water for Food Institute and the College of Public Health at the University of Nebraska Medical Center. I'd also like to thank my colleagues, both at UNL, Nebraska Lincoln, and also at the Medical Center for frankly inviting me in to give this talk. I'm absolutely delighted to be here. Now, Molly took me to task when she asked me to give this talk, and she said, you better have some good news. So I promise you at the end of my talk, there will be good news associated with this talk. If I could have the next slide, please. In what we were just talking about, there are a couple of central themes that I'd like to point out to everyone. And there are really three, and it was in my title that was on the previous slide. And one is connectivity. The second is some bad news, and I'll give you a little bit of bad news. You all know what that bad news is because we've heard a number of different cases of it thus far. And then I'll give you some good news to kind of end things. So let's start with connectivity. And I love this quote from Reverend Peter Rabel. We sit in the shade of trees we did not plant. We drink from wells we did not dig. We profit from persons we did not know. The water cycle is not independent of humanity. We are the water cycle. Humans are 80% water. The water cycle literally flows through us. It's not just something that we measure or take advantage of environmentally. We are the water cycle. If I could have the next slide. Now, with that said, if you were to go to a classic textbook and look up what the water cycle is, you would see something like this. And many of you probably remember this from a high school class or an early college science class, perhaps. And effectively, and Dr. Bartelt Hunt also talked about this in her talk, during the water cycle, effectively it begins with evaporation of water from a large water body like the Great Lakes in the Midwestern United States or the Atlantic or Pacific Ocean or wherever else. That water vapor then moves atmospherically, winds up in precipitation, rain or snow, which then through runoff events winds up trickling back down the landscape back to the large body of water from which it came. If I could have the next slide. Great. Now the important point here is if you juxtapose the water cycle on top of climate change, what you realize is, and in the old days, when you're an old guy like me, we used to call it global warming. And it's bigger than that. And this slide exemplifies that. For example, in the Pacific Northwest, where I live in Idaho, we've been having historic troubles with both drought and fire. Well, the water that is put into the atmosphere during droughts is going to go somewhere. So that water will then travel and lead to precipitation events, possibly significant and potentially harmful precipitation events downstream. And Jesse earlier on in his talk was talking about the catastrophic floods that were occurring in Nebraska and the fact that those absolutely have adverse impacts on public health. If I could have the next slide, please. Now, we all probably have seen the water cycle, or at least you know of it anecdotally, the one that I previously mentioned, because that's what's in textbooks. But there's really another water cycle out there, and that's what I'd like to talk about next. So could I have the next slide? Effectively, what happens, as we all know, is that there is natural water, raw, wild water. We as humans collect that water either for personal consumption, drinking, or for washing our hands, which we're all doing a lot more now during the COVID-19 pandemic. We take that water, we irrigate our livestock with it, we irrigate our crops with it. So the humans are diverting the natural water stream, taking that water and using it. Could I have the next slide? That stream then ultimately, that water, I have to just put in a little amusing story here. I once had an undergraduate student come to me and say, I'm interested in doing water research because if we don't, we're gonna use up all of the water. Well, we don't use up the water cycles, right? The water is used and then we clean it either from the perspective of a wastewater treatment plant, or we have it run off on our roads, or it runs off agricultural fields, and it ultimately winds up back into the environment. This is the other water cycle, and this is where some of the problems come from, as you all well know. Now, I've heard that in the Mississippi River from Lake Itasca in Minnesota to the Gulf of Mexico, this cycle of withdrawal, use, and return is happening anywhere to 7 to 11 times during that transition of water from the headwaters of the Mississippi River down to the Gulf of Mexico. Can I have the next slide? And here's the bad news. And again, we all remember this from either a high school or college science class we once had. Water is the ultimate solvent. Therefore, many of the chemicals or compounds that you see addressed on this slide actually solubilize into the water. If they don't solubilize, they can also be carried as particulate matter. Therefore, the water is acting as a transport system. So during that other water cycle that I was talking about a few minutes ago, during that other water cycle, we're having chemicals and microbes and particles hitchhike on that water and wind up in places where they're not supposed to be. If I can have the next slide. For example, in the United States, this is just a graphic representation of the national violations of the Safe Drinking Water Act. So raw water that is being brought in for potential drinking water purposes. And then on the other side of that, where it's actually being distributed, looking at whether or not the water quality is violating the Safe Drinking Water Act. And as you can see from the number of bubbles and the size of the bubbles on this map, this is a significant issue in the United States. Can I have the next slide? Now, I promised Molly that I would sort of end my talk with some good news. So I wanted to feature these three individuals. Two of them you may not recognize any of them. One's perhaps more popular, at least today, than the other two. But let me go through this real quickly. Can I have the next slide? This man is Dr. John Snow. John Snow was a physician who lived in London in the 1850s. He was instrumental in single-handedly ameliorating the cholera outbreak in London in 1854. He was also the first, for all practical purposes, he was the first environmental epidemiologist, and he was able to map the distribution of cholera cases in the Soho region of London, and he recognized that this pump that's shown in this slide was actually being used for drinking water from a contaminated water source that was contaminated with cholera. By removing the pump handle on the pump, for all practical purposes, Dr. Snow became the first public health official that actually remediated a disease through an environmental action. Can I have the next slide? This is Major Walter Reed. And Walter Reed was given the commission of taking over the island of Cuba, taking over the US military that was stationed in the island of Cuba right around the turn of the 18th to 19th, or I guess the 19th to 20th century. The issue there was that Major Reed was having his troops absolutely devastated by yellow fever. Now you must remember, in 1900, the etiology of insects as disease vectors hadn't really been described, so they really didn't understand this very well. However, Major Reed figured it out. He went through the main population areas. He removed, through effectively civil engineering, he removed the sources of stagnant water. By doing so, it didn't allow Aedes aegypti, this mosquito, which is the vector for yellow fever. It didn't allow them a place to breed. The insects died. Yellow fever was remediated. Since that time, Cuba has not experienced a yellow fever epidemic, 120 years. And it was really done instrumentally by this one man. Pretty impressive piece of the relationship between water, public health. Finally, and the one person on this slide that you might all potentially recognize, could I have the next slide? This is Rachel Carson. Rachel Carson wrote the book Silent Spring in the mid 1960s. Her book wound up, and if you have not read it, by all means read it. It is essential reading for anyone who's in on this talk today, because she was an absolute visionary, and she's one of my personal heroes. Just throwing that out there. Rachel Carson, her book led ultimately to the development of the Clean Water Act, the development of the Clean Air Act, the development of the EPA, and also the banning of a number of different organochlorine pesticides, including DDT. She was this one individual perhaps is the most important environmental scientist and public health scientist of the last 120 years. And I'll argue with Jesse about that at another time, but one of my personal heroes. Now you're probably looking at this slide and you're thinking, okay, we've got a physician, we've got a major, and we've got a noted scientist. But here I am, and I know many of you are in other states outside of Nebraska and other countries outside of the United States. Here I am, I don't have that kind of infrastructure available to me. What can I do? Maybe you're a high school student who's watching this, or an early college student. What can I do? Can I make a difference? Let me tell you a story about another of my personal heroes. Could I have the next slide, please? This is the Maysville, North Carolina town manager, Shumata Brown. I've talked to Shumata now a couple of different times, and what he is doing is truly heroic. Next slide. This is a map of North Carolina, and Maysville is where the red star is, and the blue star is close to Fayetteville, and it's also the site of the Chemours industrial plant. The Chemours industrial plant generates polyfluorinated alkyl compounds. Some of you may have heard of PFAS, the acronym PFAS. In that process, they also generate this chemical that you can see in the upper left-hand box, known as Gen X. Gen X has now moved through the groundwater and is contaminating the water supply of Maysville, North Carolina. Now you might think, okay, well, this guy must be a civil engineer. He must have a PhD. He must have spent time at the CDC or NIEHS or the EPA. No, he's a real estate agent. He was given this, he took this job because no one else in the well before PFAS, but he took the job because no one else in the community had an interest, frankly, in doing it. He needed to take this job in order to safeguard his community from adverse impacts based upon the water supply. And again, he took the job knowing that well before the Gen X outbreak. Look what he said. Could I have the next slide? Some people say that the board, this is the board of Maysville, North Carolina, never does anything, and the town never does anything. We found Gen X, we took the correct action. The correct action was to get the North Carolina DEQ involved, where they're doing testing. They're also bringing in water outside of the groundwater for the citizens to drink. I think that speaks volumes on what we are trying to do around here. The reason I bring up this slide is there's really no reason that anyone on this, involved in this webinar today, there's no reason that you can't evoke within your communities the type of work that, for example, Shannon was talking about earlier as far as citizen science and environmental monitoring. It is absolutely possible. It is absolutely doable. And I'm going to just throw this out there. The College of Public Health at the Medical Center, the Daugherty Water for Food Institute, and shameless plug, the University of Idaho is here to help and assist in you doing just that. So if you're thinking, I don't know what the first step is, by all means, reach out to these experts in the field because they can absolutely help you. With that, can I have the last slide? I'd just like to leave you all with this great quote from Margaret Mead, and that is, never doubt that a small group of thoughtful, committed citizens can change the world. Indeed, it's the only thing that ever has. And although Peter Bukarnik, who's on the phone, on the conversation, and also Molly might be a little bit frustrated by me saying this, Daugherty Water for Food's a fairly small institute. When you look at something, and if you compare it to something like the United States government, it's a pretty small institute. Never doubt that these people have the capacity to actually get something done, because they absolutely can. With that, again, it's been a great pleasure to talk to you all today.
Thank you so much, Alan, for that surprisingly uplifting and positive presentation. It's obviously very helpful to see the broader scope of impacts and the issues related to water quality and health. And now I'll turn it back to Jesse to offer his feedback on the presentations and also facilitate some questions with our panelists.
Yeah, thanks, Molly. I really appreciate it. And I really appreciate this opportunity to host this panel and talk about some of these issues and talk about some of the future hope that we have in working with water, climate, and health to try to address some of these problems as well. And we had a nice breakdown, everything from Ann Hubbard talking about why she thought that this was important and the impacts that she was seeing as a physician and why she wanted to make sure that we were doing solutions to problems before they turn into problems. Then we moved forward and we had Shannon talk about some of the water quality issues across the state, some of our sampling issues, but then also talking about how citizens can be involved, and citizens are a part of this to make sure that we have solutions as well. And then we had a really good talk from Mike, who came in and hit us right between the eyes with some of the information that he's having to deal with locally and how this is impacting the region that he's working with. And then lastly, Alan gave us some bad news, but gave us some good news on how we could come together and actually individuals can be instruments of change. And hopefully that's one of the things that we can work towards, is making sure that water, climate, and health is actually an instrument of change so that we can actually be trying to tackle and deal with some of these very important issues that we're facing across Nebraska. And so with that, I have a number of questions already that we've accumulated, and I'm going to throw some of these out here to our panelists. And also, I think there's a few in here that I'm going to have to address as well. And so the first one, and I think this one was going to go probably to Alan or Shannon, but maybe also Mike, which is, what are the likely, it moved on me, what are the likely emerging contaminants or issues that we might be seeing in the future? And I don't know if anybody wants to first take a stab at that. I see Shannon.
Sure. Yeah, I can. So I think that, you know, again, not to paint a bad news picture, but I think that there's just a wide variety of water quality challenges that we face in Nebraska, but also globally. Some of those emerging issues right now that are very much on the front are a focus on, again, some of these biologically active compounds such as antibiotics and pharmaceuticals present in water. Those can come in urban areas from wastewater effluents. Our wastewater treatment plants are not designed to remove those kinds of compounds. And so they typically pass into the effluent and are discharged, as well as some of them are consolidated in municipal biosolids, which can then be land applied. There's a focus right now also nationally on PFAS. So in Nebraska, thankfully, we don't have as many industrial sites where PFAS is used or manufactured, but nationally and globally, that's certainly a very important topic right now. I think there's a lot of concern also about microplastics. We see a lot of ocean studies about ocean contamination, but the sources to ocean are fresh waters. So if we look in all of our freshwater systems, there's concerns about microplastics. And then I think, again, just going back to some of the microbiological contaminants, especially when we look about the linkages between antibiotics and antibiotic resistance. And then to add everything together, I think there's a lot of unknown questions around toxicity or health impacts of mixtures. So if we see an antibiotic or a pharmaceutical, it's typically not there by itself. It's typically in the presence of other compounds. Also, we talked about nitrate and atrazine. Those also are not just detected individually, they're often present together. So I think that's another very complex issue that needs a lot of research is how do you look at those mixtures and what the effects of exposure to those types of contaminant mixtures might be.
Jesse, I'd just like to add something really quickly to that. I think Shannon did a great job of giving an overview on that. But I'd just like to add two things to that. One is that the era of organic chemistry began right immediately before World War II. And since that time, our production of organic chemicals has, organic meaning just a chemical with carbon in it, has absolutely skyrocketed to the point that now there are literally tens of thousands of chemicals in the environment that weren't there pre-1920. Now, the interesting thing relative to that is the number of chemicals that have actually gone through, and that either a state or a federal agency has generated regulatory limits on relative to what can be in the environment is down in the tens to hundreds of chemicals. So there is a vast chemical warehouse out there of potential contaminants that we really don't know very much about. And the other thing, and again, I'd like to reiterate what Shannon said because she's 100% correct. The mixture question of how those chemicals are going to interact as mixtures in the environment is vitally important.
I didn't know if Ann or Mike had anything to add to that, but.
I'll just echo exactly what Shannon said and what Alan said. We're looking at the byproducts of some of these chemicals. They turn into other things, and then when they mix with something else, what are the results of that? And then you also brought up microplastics. Some of the citizen work we're doing with the schools, they actually approached us, the students, that was something that they wanted to look at. So we provided them with the testing equipment to test the Norfolk that runs through Norfolk, Nebraska. They're currently going to start testing that and give us an annual report on microplastics. But that was being driven by the students.
And I see another question. This one's a little bit more for me. It was what portion of the funding or research will we use to test private domestic wells in Nebraska and test them for a wider range of contaminants, domestic wells around the Omaha metro area. So with that, we're still in the growing process of this program. And what this is going to look like over time is going to be based off of the collaboration and partners that we build as we move forward. And so everything right now is on the table. And we're already partnering with Shannon and Alan and Mike and a variety of other people across the state that will help build our platform of what we're going to be doing. So I definitely think that some portion of this is going to be looking at domestic wells and then also looking at a wider range of contaminants. What that actually ends up looking like is going to be based off of what our partners push us towards, because we're going to be developing a steering committee that are going to have local partners, going to have academics, state partners to really help us try to figure out what are our next steps and how do we want to tackle that. And some of that also will be coming back to the funding for the students that are going to be involved, because we're going to have funding opportunities for students. And so if you're a student out there, or if you're a faculty member that's looking for opportunities of funding students, please consider some of the funding opportunities that are going to be coming out of DWFI and UNMC to hopefully be supporting some students that are working on these issues that'll be through the program. And through that student funding, we will hopefully have the next generation of problem solvers that are out there trying to figure out some of these problems that we're talking about and trying to make sure that we're doing effective research and communication on some of these issues as well. So I think that was my little plug there. I didn't know if anybody had anything that they wanted to add to that. Okay. And this one I think is a little bit more of a One Health focus. So I want to know if you're having any problems with animal intoxication or toxins, I'm guessing, in animals across Nebraska or maybe across the country. And so I was actually going to throw that at Alan because I think you've done some work in that area. So
yeah, we did do some work in that area, and and the short answer to the question is yes. Are there fish and wildlife issues relative to toxicity that are occurring? The short answer is yes. However, trying to think of how to approach this, because there's really, it's such a nuanced question, because, and again, I apologize, I'm just going to take a 1 minute here. Historically, I keep coming back to history, and anyway, historically, toxicity was evaluated relative to the dose makes the poison, right? Which gets to the point of high dose chemicals that produce massive adverse effects. And much of that, and if you think back to like the 1960s in the Great Lakes, or the DDT story with Rachel Carson, much of that has been cleaned up. And that's certainly true in Nebraska, just like everywhere else. Much of that in the United States has been cleaned up to our enormous benefit. And that's absolutely true. The problem though, and if you notice what Shannon and Jesse were talking about earlier on in this conversation, the problem is when you start talking about chronic issues that are being initiated at relatively low doses. So for example, chemical initiators of carcinogenicity. Now the concentrations of chemicals that can lead to those type of impacts can be quite low. And that's the type of impact that my work in Nebraska for about 15 years illustrated, which was molecular impacts in the animal that could potentially lead to carcinogenicity, or also perhaps more importantly, potentially lead to adverse reproductive health impacts. Animals, frankly, females not being as female as they would be prior to the chemical, or males not being as male. So what we're seeing is a subtlety both in the adverse health impact and also in the exposure, which makes it very, very difficult to evaluate, and is something that both Shannon and Jesse and I and other members of this group that are collaborating with us have been scratching our heads on for the last few years.
I don't know if anybody wanted to add anything else to that. So I actually had a question for Mike, and this is a little bit of a random one, so feel free to answer it however you want. But I'm kind of curious, either within your NRD or across other NRDs maybe that you've heard of, how many of them are working with public health or healthcare in some capacity to tackle some of the issues that they're seeing?
Jesse, unfortunately, very few. This seems to be a new emerging thing, which for whatever reason, that's just the way it is. So I've been trying to engage with UNL, with Ann, with whoever will listen, that I need help. I need help up here. So I want to thank Ann and this group for putting this together and pushing this issue forward. But I think a lot more work needs to be done, not only just in this district, but with all the other districts in the state. And hopefully, as we go down this path, we'll start highlighting some of these findings. We can get some of this research done and really find a path to move forward to address the problem.
Thank you. And then we have a question from Vern Powers, who is asking, can you also address the proliferation of uranium plumes tagging along with nitrates? And I was wondering if maybe Ann or Shannon, if that one should go to either of you.
Sure. Okay. Yeah. No. Yeah. So we're fortunate to work with a colleague at UNL, Carrie Weber, who I think was one of the first to publish on this topic, that what she was finding was co-occurrence of uranium and nitrate in groundwaters across Nebraska. And I believe the issue is that the nitrate, the presence of nitrate solubilizes some of those uranium species that are present. And so then of course that creates a kind of, again, like the mixture impacts a more toxic effect from that co-occurrence. And so in some of the work that we didn't touch on today, but that we are analyzing relating water quality and health, we have pulled Carrie into the group, thankfully, and are starting to look at the occurrence of some of those uranium compounds in addition to nitrate and atrazine. So looking at a mixture of the geogenic, the uranium, the naturally occurring compounds that can still have toxicity, with the anthropogenic, the nitrate and atrazine, but things that are present in the environment from human activities.
And then the next question I have here, and this one might be Mike, and it might be Shannon, might be Alan, might be all three, but this is a little bit more of a policy question. So once high levels of groundwater contamination have been detected, what procedures do environmental authorities follow? What are the next steps?
Well, I'll take the first stab at this. We're currently, we have thresholds that are spelled out in our groundwater management plan. And so it's basically a game of numbers. We go out and test as many wells as we can. And if we reach certain thresholds, percentages of 20% of these wells are a certain threshold of nitrogen, it kicks into we can go to, we call them phase areas, and we delineate an area, and then with that comes regulations. Like I said to begin with, we've been heavily relying on education and voluntary measures. But 50 years into this, we're not making any progress, and so now we're starting to see some regulations. Currently, we are requiring split application of nitrogen. We're requiring water samples, soil samples, the top 2 feet at least. We're requiring nutrient management plans. And if these producers don't comply with these requests, with these requirements, we've been issuing cease and desist orders that you can no longer use your irrigation well, you can no longer put nitrogen on this piece of ground. And once we send those out, compliance happens fairly quickly after that. But always trying to get this message out, trying to make this issue relevant to the general public, because I believe it's more or less fatigue. They've been hearing about this for 30, 40 years, and we're not telling them anything new, but we're also not seeing any change in their behavior. So I'm kind of going down that route of human behavior. I don't want to regulate. I do not want to go down that route, but we also got to find a way to make this relevant to the people that are living here, for them to care enough to start making these changes.
I'll maybe add on just a little bit relative to public drinking water supplies. Of course, I think it's important to note that those supplies are tested very regularly. There are federal regulations, state regulations for testing of those municipal drinking water supplies, but where there's a little bit of a hole is the testing of private wells that are being used for drinking water supply. So there's some potential there. Typically right now, at least in the state of Nebraska, there's not a testing requirement. So homeowners may not be aware of the quality of their private well, or they may not test it regularly. The other thing I'll add with some of the compounds that we've talked about, PFAS, antibiotics, microplastics, none of these are regulated currently. And that's the other kind of hole, is that we have these more emerging contaminants where we don't currently have any federal or state regulation in terms of what's the next allowable or a safe level of those compounds. And development of those types of regulations takes a long time, which is why it's critically important to have information on the health impacts of exposure to those types of contaminants, so that those regulations can be used in setting regulations. So I guess I'll just add those two things, that with some of the types of compounds we're talking about, they are not regulated, so they are difficult to manage from that perspective.
And we have a question from Nigeria, and that was talking about the dilemma that they're facing there with the chemicals that they're using for agricultural production are now becoming dangerous for human health. What then are the ways out? How can we now reconcile agricultural production and health? That's a broad one.
Jesse, do you mind if I
Go for it.
approach that question? And again, just remind me again, Jesse, that came from Nigeria, is that right?
Yes. Yeah.
Yeah. Thanks for that question. And the reason I asked what country that was coming from is because I'm not so sure that I don't know exactly. I don't know exactly what you, how well you're following what's going on in the United States. But the interesting thing there, I'm sorry, Jesse, would you just, I apologize. My brain's thinking faster than I'm talking. Would you just kind of summarize what the question was again? I apologize.
Sure. So they were talking about their dilemma in Nigeria with the chemicals that we use for agricultural production are now said to be dangerous for human health. What then are our ways out? How can we reconcile agricultural production and health?
Great, thanks. And again, I apologize for that, but what I wanted to say about that question, and the reason that I was bringing in the United States and a little bit, and I'm not going to get into it, but a little bit of United States politics is for the international individuals on this conversation today, what you may not realize, perhaps you do, but what you may not realize is that in the United States, scientific inquiry in itself is currently under attack in October 2020. So we are having the foremost infectious disease public health official in the country being attacked by our central government and questioned on what his understanding of infectious disease. My whole reason I'm saying this relative to the question is trust the science. So I think the very first thing that needs to happen in Nigeria or anywhere else is to really understand the fate, the transport, and the biological impacts of the chemicals that you're talking about in the environment that they're in. And I recognize that this can be a devastating issue relative to adverse health outcomes, but you absolutely need to let the science structure your approach towards the chemicals. And with your general question and not knowing what the chemicals are, it's very difficult to give a much more pointed answer than that. But it is hugely important that you trust and let the scientific inquiry identify the problem, just as what we've been talking about here from Mike to Shannon to Jesse today. Identify what the problem is so that you have the data and you have the scientific background to be able to either remediate it or at least or understand it and then work from there.
Jesse, can I add to that answer? The other thing that
Sure. As long as Molly says it's okay.
What's that?
We do need to wrap this up.
Oh, then I'm done.
You've got a couple minutes.
I would try to do whatever you can to move away from chemicals. Use biological systems. The ecology that was there prior to the crops was working. It was in balance. Work some of those things back in, whether they're cover crops, soil health, bring back biology, bring back the bugs, bring back some of these natural things that are happening, and you can move away from the chemicals and not even have to deal with the problem.
And maybe the very, very last thing I'll just say is I really feel like the NRD system in Nebraska can be a real model for other locations. So maybe just putting that plug in for Mike and the other Nebraska NRDs and looking how that could be exported, because I think that can be a very locally controlled and powerful way to help in those situations.
Well, and I'm sorry to be the bad guy, but we do need to bring our discussion to an end. We've reached our time limit. But thank you all. We've had some amazing discussion, excellent presentations. Thank you to our speakers for sharing your expertise with us today. So thank you all and have a great day.